Every new day brings a new hope, a new aspiration, a new idea. It's another beautiful morning, and I want to welcome you to another episode of the program, Clinicology. It's our health show coming to you from the studios of the New Frontiers Television. And I am Temitope Oladipo, and I will be your host on the show. It's a program where we discuss health-related issues, where we discuss first aid tips. We discuss anything that has to do with our health. This is a program where we take as paramount our well-being, our health being, and everything that has to do with our health status. So if you are coming for the first time, I want to say you are welcome on the show. Few days ago, precisely May 5, it was International Day of the Midwives. It's the day to celebrate some kind of women, some set of women that first come in contact with the newborn the moment they were being born into this world. So it's a day set aside to celebrate this wonderful set of people that take it as a job, that take it as a passion to nurture and to bring out to life this newborn. So it's a day that every woman looks out for, every woman aspires to celebrate. So International Day of Midwife is a very, very paramount day in the world. So we think it's imperative for us to know few things about the International Day of the Midwives. International Midwife Day is celebrated every year on international level to commemorate and increase the awareness about the contribution of the midwives towards the patients all over the world. 5th of May was established to be celebrated as a day to honor the midwives for their big contribution towards the health of their nations. It is celebrated with great enthusiasm and joy in more than 50 countries around the world. First International Day of the Midwife, IDM, was launched and celebrated on 5th of May in the year 1991 using the theme towards safe birth for all by year 2000. The day was celebrated on annual basis to fill the demand for the following theme: the world needs midwife more than ever before. International Midwives Day was decided celebrating annually in the Conference of International Confederation of Midwives, ICM, Netherlands, in 1987.
Hello everyone, my name's Sheena Byram and I'm a midwife from England. I hope you like my Call the Midwife bag. I'm making this little video for all the midwives around the world for International Day of the Midwife 2017, and I just wish you a very, very happy day.
Hi, I'm Mindy. Happy International Midwives Day. I'm here in India spending time for a year embedding midwifery program in Fernandez Hospital and for all the other rural districts around in India.
You're making a difference every day. Keep smiling and stay positive. You're amazing.
Midwives
are brilliant.
How brilliant are they?
Really brilliant.
Hello everybody, it's Tracy Cooper here from the UK, and I want to wish everybody a happy International Midwives Day. I might look a bit rough, I've just got off a flight from Cork after seeing some fantastic midwives in Ireland, which I've had the pleasure of spending a couple of days with.
Hi, I'm Jackie G and I'm a midwife and I work for the Royal College of Midwives, and I'm delighted to say Happy International Day of the Midwives. We're so proud of what you do. Keep up the great, fantastic work. Keep positive and love your women and love one another.
You are amazing human beings, and I record this, and even as I say it, I know I'm at risk of sounding cheesy and sentimental, but it comes from the depth of my heart. Thank you very much.
Hi Sheena, I'm here today in Dublin with Janine at the Essence of Midwifery Conference. A big shout out to all our colleagues across the world on International Day of the Midwife. Yay!
Hi, I'm Diva Ranti. I have been qualified midwife for 2 years. I have enjoyed to help mother to birth naturally.
Hi, Cathy Warwick, Chief Executive of the Royal College of Midwives. Hello to every midwife and maternity support worker on International Day of the Midwife.
Hello, this is Evita from India. I'd like to thank and honor each and every midwife around the world who has invested of herself to take care of our mothers and their babies.
Hello lovely midwives, it's International Day of the Midwife 2017. If you've been following my blog midwifediaries.com or you're part of my group on Facebook which is called The Secret Community for Midwives in the Making, you'll know that I think you guys should be greeted on shift or on community or out independently with cups of coffee in gold-plated mugs.
Happy International Day of the Midwife!
I'm Dr. Alison Barrett, and this video postcard is coming to you from New Zealand to say Happy International Midwives Day to all of my midwifery friends and colleagues around the world. I'm so grateful for your holding the space for women and for persisting nevertheless.
So on International Day of the Midwife, I want to say a huge thank you to all the wonderful midwives who have supported me, inspired me and kept me going during the tough days of being a student. You've all made me the midwife that I am, or almost am. Thank you.
Hi, I'm Hannah Darlin. I'm Professor of Midwifery in Western Sydney University, and on International Midwives Day, stay strong, remember trust in birth, and remember the most important job a midwife has is to keep fear out of the room.
Thank you. To wish you a happy International Day of the Midwife. And I want to send you lots of positivity. What you do when you look after women with care and compassion, it makes a huge difference. Keep going.
Hi everybody, it's Deirdre here from the Global Village of Midwives. I wish you all a fantastic International Day of the Midwife, and my key message is to promote loads and loads of kindness. To be kind to yourselves, to be kind to women and to be kind to families that you meet. On International Day of the Midwife, I would love to offer you all a global oxy hug to get those oxytocin levels up and get the love up. So if you see a midwife today, give her an oxy hug and have a great day. Bye.
Hello, my name is Renike Schramm. I've been a consultant obstetrician for more than 20 years. In those 20 years, I've worked with some pretty amazing midwives. I want to wish you all a very happy International Day of the Midwife. Let's continue to work in partnership with mothers and their families and between obstetricians and midwives. Have a great day.
Happy International Day of the Midwife 2017 to all you wonderful midwives out there. I may well see some of you today on the demo in London for Save the Midwives. Us women, we really need you midwives, so it's a fantastic profession that needs protecting. I hope you're being spoiled today. Sending you my love from Michelle Quashie, mum to four.
Hi, my name is Lina. I've been a midwife since 1999. I trained in America and Asia, worked in Asia. My favourite thing about being a midwife is continuity of care and being with women, and that doesn't always have to be continuity, but I feel like I have done my job better as a midwife when I really know her, but also enjoy working in lots of different situations with lots of people from all over the world, and wishing everyone happy Midwives Day.
Right, hi, I'm Andy. I'm an obstetrician speaking in Ayrshire at the MAMA conference on gentle and caesarean birth. I've had a fantastic time. I think it's been great to collaborate with the midwives, and I really want you to keep up the good work, and I hope we can continue that collaboration.
International Midwives Day was decided celebrating annually in the Conference of International Confederation of Midwives (ICM) in Netherlands in 1987. ICM affiliates midwives from all the organizations to its ICM Express in order to develop harmony and improve the knowledge and skills of all the midwives. Varieties of events are organized during the celebration in order to support the safe motherhood as well as promote the midwifery profession throughout the world by increasing the awareness about their contribution. While International Midwives Day is celebrated, partners all around the world join as a member of the International Confederation of Midwives to mark 5th of May as International Day of the Midwife. They celebrate this event throughout the week, but by participating in many activities, it is celebrated to highlight the importance of their role played in achieving the allotment of their nations. According to the statistics, It is noted that approximately 350,000 women are dying every year due to pregnancy hazard or during childbirth. Around 2 million newborns babies are dying just as their birth or within 24 hours of birth, and around 2.6 million of the cases are stillbirths. Such death rates can be lessened and prevented by having more precautions and safety measures to the pregnant women and newborn babies.
I decided to become a midwife after meeting one during my annual exam. And then I started doing research about midwifery and just fell in love with the women's health, the empowerment, the education aspects of the type of care that midwives provide. One of the biggest misconceptions is that midwives don't work in hospitals, but actually the majority of midwives in this country do work in hospitals.
I like working with the midwives because I think they're true examples of dedication to their patients. They'll come in at odd hours, they'll stay up all night with the patient, not just when they're pushing, but during the whole time of their labor. I think that they're models of what should be the connecting piece with a provider and the patient. I think from a patient point of view, midwives bring a certain intimacy and an emotional connection that patients really value when they're having something as life-altering as a birth.
I typically take care of low-risk women. We do lots of family planning, lots of annuals, menopause. We do everything. Women through the lifespan.
I was not aware of everything that using a midwife would offer. However, as far as once the appointments continue to go, I learned of the full array of services that they offered, not only to me, but to my family.
My midwifery practice has a great relationship and works well with doctors. So it made me feel good to know that if a complication were to arise, they would be able to work together for the best possible outcome.
I was diagnosed with a twin pregnancy when I was about 12 weeks pregnant. Having Ebony and Dr. Freeze collaborating gave me a great peace of mind. I felt like I was receiving the care that I needed with a twin pregnancy, but also receiving the care that I wanted with a midwife. They were both on the same page, and every time I came in for a visit with Ebony, she had all of the information from Dr. Freeze.
A lot of women love coming to midwives for hospital birth because when she's admitted, we do some entry monitoring, but then we do intermittent auscultation, which means that we listen to the baby periodically. We do not do continuous monitoring. We don't do running IV fluids. We just have IV access, and we allow women to walk around the room. She can utilize the shower. She can get in any position that makes her feel comfortable, which I think is very important.
One of the myths that I heard about midwives was that you couldn't have any sort of pain relief. They didn't do any sort of prescriptions or drugs at all.
I'm very proud to say that women can come, and even if she comes in and her plan was to have an unmedicated birth and she wants pain medication, she can have it. Being with a midwife doesn't mean exactly unmedicated birth. It means being with a woman in whatever way she decides to birth.
I would definitely encourage a friend to try a midwife at a hospital. I feel like midwives can provide the type of care that you could be looking for but still work in a hospital environment where a lot of people are comfortable.
What I would say to a mother who's thinking about having a baby in the hospital with a midwife is great choice.
In order to make some positive efforts towards the health of the nation, International Day of the Midwife has been started celebrating every year to increase awareness about the roles of women as well as to fulfill the increasing needs of more midwives all over the world. The universal efforts of implementing well-educated and harmonious midwifery workforce in all the functioning health system by availing proper equipment and other supplies has been started to prevent up to 60% of the maternal and child death rates throughout the world. As there is a critical shortage of the skilled and energetic midwives on global basis, it is very necessary to fulfill the needs of health system. Shortage of the skilled midwives is faced by all the countries due to many reasons such as insufficient training facility, poor workforce planning and management, low quality education system, no precaution measures for the midwives from HIV/AIDS and many more. International Midwives Day is celebrated to ensure the universal coverage of maternity care by fulfilling the need of the estimated 350,000 numbers of midwives globally. A big step has been taken by the International Federation of Gynecology and Obstetrics to enhance collaboration among obstetricians, gynecologists, and midwives in order to strengthen the midwifery all across the world. International Day of the Midwife is celebrated by the virtual International Day of the Midwife VDIM by bringing together the midwives, consumers, students, and other interested in childbirth all across the globe. During the celebration of the day, midwifery services are encouraged by enhancing the quality, training, and implementing innovative technologies, enabling required environments for the midwives to play a vital role in the particular community, society, and thus in developing countries.
I am Puzinesh Alamu. I work in Jinka Zonal Hospital for 30 years. And I am clinical nurse. I am experienced as a midwife. I work as a midwife. I help many women and assist delivery and teach others midwife how to deliver, how to manage.
she have delivered the upper shoulder, just she will tract the fetal upward. This blood is important for the newborn. It prevents anemia.
በጣም ከፍተኛ የሆነ ክራምፒንግ ካለ ግን ወዴት ነው የሚሄደው?
I want to be a midwife.
I want to be a midwife. I want to be a midwife. I want to be a midwife.
International Midwives Day is a global campaign being celebrated all over the globe in order to highlight the importance of midwives towards the health of the mothers and babies by organizing a lot of activities. It is celebrated every year using a particular theme of the year to make it effective and fulfill the objective of the celebration. Midwives from local health centers, Midwives Association, as well as supporters of midwifery all over the world celebrate these days by developing their own significant activities. Some of the activities which are organized to celebrate this event are performance activities, singing contest, march, run, street parade, public place rallies, organizing stores in the popular market, information and advice activities, meeting, workshop, conferences, news, and many more activities organized by the government, NGOs, and other non-governmental organizations. Lots of activities are organized during the celebration to increase the local and national level publicity as widely as possible about the midwife's roles and requirements. It provides a significant opportunity for each and every midwife to think about profession to grow, widen their knowledge and skills. It is also publicized using social media sites through sharing ideas and post activities. Global Midwifery Symposium is also organized in the Kuala Lumpur using the title of Strengthening Quality Midwifery Care, Making Stride, Addressing Challenges. It is organized to highlight the key issues and addressing the midwifery service availability, acceptability, accessibility, and enhancing the care quality. Since midwifery services are very significant to the women and their family, it is need to be enhanced on global basis by removing all the financial as well as social barriers. Global Symposium is organized to bring together the midwives community to engage them in the midwifery education, strengthen association development, regulation, enhancing the skills. Panel discussion is also organized on the theme of acceptability of midwifery service to highlight the key issues and fulfill the challenges. This year's theme of the International Day of Midwifery is Midwives Making a Difference in the World.
I wanted a chance to do what my body was made to do. I was really focused on both my baby's health and my health.
I didn't want my birth to be dominated by wires, tubes, needles. I just wanted a chance for a low-stress, drama-free, and healthy birth for my baby.
I would describe the state of childbirth in the U.S. today as concerning. It is not necessary for 1 in 3 women in this country to have a baby surgically. The cesarean rate is on the rise in the U.S. because we have forgotten that childbirth is a normal process and we tend to have more interventions during labor. Some of the consequences of interventions during labor and delivery for low-risk women are harder labor, a longer labor, more painful labor, and a sense of loss of control of the situation. We have now come to schedule births, and we have now come to try to hurry births and put them on time clocks. Nature doesn't necessarily work that way. The reality is that most of the births in this country are low-risk births that require very little intervention. Midwives are well suited to help women achieve the births that they want because we want you to be successful. We want you to have a normal birth.
Always asking yourself, is this intervention necessary?
She's trusting her own body and let the natural process go on its own.
If we just keep our hands off and let birth happen, for most women, it will be normal.
Some of the benefits of a normal birth are more bonding with your baby, the ability to recover faster, and then there is the fact that you will not have to recover from major abdominal surgery and take care of a newborn. Midwives can help women have naturally progressing normal births by first protecting the mother and trying to make her feel safe and supported in the environment.
I think some women think, oh, they've got the midwife. Oh my goodness, that cuts me off from everything else.
Working with a midwife does not mean you cannot get an epidural. A midwife can help a woman choose her options about pain management in labor by starting the discussion prenatally. Once a woman knows what is available to her to help her get through and cope through the labor process, she is already ahead of the game because she's already part of the process.
I think a lot of times women leave birth feeling like they're not sure what happened to them. Every woman deserves to have a birth that leaves her and her family feeling stronger than when they started.
A woman, when she's looking for a provider, needs to ask herself these questions. Is this person listening to me? Do I feel respected? Do I feel like an individual, or do I feel like just another patient? A woman needs to make sure that she picks a place where the whole healthcare team is on board so that she can have what she needs to feel supported and have her baby safely. Midwives are particularly suited to helping women be active participants in their care and in their birth because we recognize that this process takes time, takes support, and takes encouragement. And midwives are absolutely there to do that.
That is it on this year International Day of Midwives with the theme Midwives Making a Difference in the World. That is much we can take. While we put a call through all the health facilities or to all governments, the non-government organizations who have one or two things to do with midwives across the globe. In case you don't have those facilities on ground that could help these people, that could help this set of wonderful people who are delivering life from our women, from our mothers. Please, let's endeavor to put those activities, those facilities on ground, and let's make work easier for these women. And in as much as we are craving to have a decrease in the rate of child mortality, in the rate of death of mothers while giving birth, we can't afford to not to have these facilities on ground. So as we are marking this year International Day of the Midwives, please, let's put all activities together, let's put all facilities together to make the work easier and to reduce child mortality rates and to reduce the deaths of mothers while giving birth. Well, another topic we'd like to look at for briefly before we call it a day on today's episode of the program is another thing that has to do with the issue of pregnancy, particularly when it comes to high blood pressure, and that is preeclampsia. This is a common sickness among pregnant women. Preeclampsia is a condition that pregnant women develop. It is marked by high blood pressure in women who have previously not experienced high blood pressure before. Preeclamptic women will have a high blood pressure of protein in their urine and often do have swelling in the feet, legs, and hand. The condition usually appears late in pregnancy, generally after like 20-week mark, although it can also occur earlier. If undiagnosed, preeclampsia can lead to eclampsia, a serious condition that can put you and your baby at risk, and in rare cases even causes death. Hopefully next week, by God's grace, we will have a specialist, an expert, a medical expert on the show next week who is going to talk more on preeclampsia. I think it's imperative for us to know every complications that comes with pregnancy. If truly we want to reduce the rate of child mortality, if truly we want to reduce the rate why mother died while giving birth. They are not supposed to die during the process of giving birth. They are giving back to life. They are giving back to nations. So we are going to bring an expert on the show next week who is going to talk exclusively on preeclampsia. What are the risk factors? What are the causes? What are the signs and symptoms of preeclampsia? Join us next week when we shall have an expert on the show who is going to talk on this. Don't forget, you can watch us on all our social media platforms, on our YouTube page. YouTube is New Frontiers Television International, on our Facebook page, www.facebook.com/NFTV1. Just hook up on us on any of these social platforms and feel free to drop your comments, your suggestions, and anything you have to say on this show, or your questions on any of the topic we must have treated, or any of your health challenges questions. Just drop them via the phone number scrolling right on your screen on any of our social media platform. Like I said, hook up with us next week Monday when we shall bring an expert on the show who is going to talk on preeclampsia. I'll see you again by next week by God's grace. So I want to say it's bye for now.
Preeclampsia is a disorder that only happens in pregnant women, and it happens after 20 weeks gestation, and in some cases develops up to 6 weeks after delivery. Preeclampsia causes new onset hypertension and proteinuria, which is a marker of kidney damage, and can also cause damage to other organs like the brain and the liver. There can be a wide range of symptoms. For some women, there might be no symptoms or only mild ones, whereas for others, it can turn into a life-threatening illness. If a woman with preeclampsia develops seizures, she's then said to have eclampsia. Preeclampsia tends to happen more often during a first pregnancy, in pregnancies with multiple gestations, or in mothers 35 years or older. Other risk factors include having hypertension, diabetes, obesity, or a family history of preeclampsia. Alright, but why do these changes happen in preeclampsia and eclampsia? Well, the exact cause is unclear, but a key pathophysiologic feature is the development of an abnormal placenta. Normally, during pregnancy, the spiral arteries dilate to 5 to 10 times their normal size and develop into large uteroplacental arteries that can deliver large quantities of blood to the developing fetus. In preeclampsia, these uteroplacental arteries become fibrous, causing them to narrow, which means less blood gets to the placenta. A poorly perfused placenta can lead to intrauterine growth restriction and even fetal death in severe cases. This hypoperfused placenta starts releasing pro-inflammatory proteins. These then get into the mother's circulation and cause the endothelial cells that line her blood vessels to become dysfunctional. Endothelial cell dysfunction causes vasoconstriction, or narrowing of the blood vessels, and also affects the kidneys in a way that makes them retain more salt, both of which results in hypertension. When diagnosing preeclampsia, hypertension is defined as a systolic blood pressure of 140 millimeters of mercury or greater, or diastolic blood pressure of 90 millimeters of mercury or greater. In severe preeclampsia, systolic blood pressure can be 160 millimeters of mercury or greater, and diastolic pressure can be 110 millimeters of mercury or greater. These extreme blood pressures can lead to a hemorrhagic stroke or placental abruption, which is when the placenta detaches prematurely from the uterine wall. Now, there can also be local areas of vasospasm, which means that less blood might reach certain parts of the body. For example, reduced blood flow to the kidneys, which are particularly susceptible, can cause glomerular damage, leading to oliguria, which is abnormally low amounts of urine, as well as proteinuria. Normally, the glomeruli of the kidney do a pretty good job of preventing protein from spilling into the urine, so proteinuria can be a sign of glomerular damage, and is classically seen in preeclampsia. Reduced blood flow to the retina can cause blurred vision, the sensation of seeing flashing lights, and the development of a scotoma. A scotoma is when a small part of the visual field has slightly worse visual acuity, which is kind of like having a blurry spot on your computer monitor. Reduced blood flow to the liver can cause severe liver injury and swelling, which can cause an elevation in liver enzymes and stretches out the capsule around the liver. Stretching of the liver capsule typically causes right upper quadrant pain, or epigastric pain, which is one of the cardinal symptoms of severe preeclampsia. Endothelial cell injury also leads to the formation of lots of tiny thrombi in the microvasculature, which is a process that uses up massive amounts of platelets. Having all these tiny blood clots in the blood is a little like having dozens of boulders in the middle of a fast-moving river. It becomes treacherous for red blood cells to navigate through, and before long they slam up against a clot and get destroyed, which is a process called hemolysis. Together, these make up the HELP syndrome, H for hemolysis, EL for elevated liver enzymes, and LP for low platelets. HELP syndrome develops in about 10 to 20% of women with severe preeclampsia or eclampsia. Finally, endothelial injury increases vascular permeability, which is when water is allowed to slip out of blood vessels between neighboring endothelial cells and get into the tissues. Because there's also a loss of protein from the blood due to the proteinuria, even more fluid moves from the blood vessels into the tissues. And this causes generalized edema, which is often seen in the legs, the face, and the hands, pulmonary edema, which can cause cough and shortness of breath, and cerebral edema, which can cause headache, confusion, and seizures. And these seizures are what define the onset of eclampsia. Because all the problems of preeclampsia and eclampsia stem from placental dysfunction, the ultimate treatment is delivery of the fetus and placenta. The decision to induce delivery depends heavily on the gestational age of the fetus, as well as the severity of the disease and how it's affecting both maternal and fetal health. If the onset of symptoms comes after delivery, then the goal is to manage the symptoms, which slowly subside on their own. Additional measures are aimed at managing any end organ damage by offering supplemental oxygen, as well as medication to manage seizures and other complications like stroke or placental abruption. Alright, as a quick recap, preeclampsia is a disorder that happens after 20 weeks gestation and up to 6 weeks following delivery. It's defined by a new onset of hypertension and proteinuria, but can affect a lot of organs, particularly the kidneys, eyes, liver, and brain. Eclampsia is diagnosed when a patient with preeclampsia develops seizures.
Preeclampsia is a hypertensive disorder of pregnancy diagnosed after 20 weeks gestation. Eclampsia is a new onset seizures in a woman with preeclampsia. Hypertensive disorders of pregnancy complicate up to 10% of pregnancies worldwide, and the incidence of preeclampsia in the United States has increased by 25% in the last 2 decades. Preeclampsia is a leading cause of maternal and perinatal morbidity and mortality, with an estimated 50,000 to 60,000 related deaths per year worldwide. The objectives of this video are to define the types of hypertension in pregnancy, describe the pathophysiology of preeclampsia, list the risk factors for preeclampsia, and describe the diagnosis, management, and complications of preeclampsia. The 4 types of hypertension in pregnancy are preeclampsia, chronic hypertension with superimposed preeclampsia, and gestational hypertension. Preeclampsia is defined as new onset hypertension after 20 weeks gestation with proteinuria or end organ dysfunction. Chronic hypertension predates the pregnancy or is diagnosed prior to 20 weeks gestation. Superimposed preeclampsia involves signs and symptoms of the disorder along with chronic hypertension. Gestational hypertension is an elevated blood pressure diagnosed after 20 weeks without the systemic findings of preeclampsia. During normal pregnancy, fetally derived cytotrophoblasts invade the maternal uterine spiral arteries and replace their endothelium, converting the high-resistance, small-diameter vessels into high-capacitance, low-resistance vessels to ensure adequate delivery of maternal blood to the placenta. As you can see in this healthy placenta, the spiral artery is lined with cytotrophoblasts, making it nice and wide to ensure a lot of blood flow. In a woman destined to develop preeclampsia later in her pregnancy, this process does not occur correctly, and the arteries remain narrow, decreasing blood flow to the placenta and causing hypoxemia. Studies have shown abnormalities in vasculogenic and angiogenic signaling pathways, but the exact mechanism for this abnormal trophoblast invasion remains unclear. The biggest risk factor for preeclampsia is history of preeclampsia in a previous pregnancy, which increases the risk 7-fold. Preeclampsia in a first-degree relative, primiparity, and multiple gestation are also important risk factors to consider. The mother's past medical history should also be reviewed for risk factors, including pre-existing hypertension, renal disease, hypercoagulability, diabetes, obesity, lupus, and age greater than 40 years. Nonetheless, it is important to note that most cases of preeclampsia occur in healthy nulliparous women with no other obvious risks. The diagnosis of preeclampsia can only be made with a combination of elevated blood pressure and proteinuria or systemic findings. The blood pressure must be greater than 140/90 on 2 occasions at least 4 hours apart after 20 weeks gestation. Proteinuria is defined as greater than 300 milligrams per 24-hour urine collection, a protein creatinine ratio greater than 0.3, or a dipstick reading of 1+. In the absence of proteinuria, severe features including a platelet count less than 100,000, serum creatinine greater than 1.1, elevated liver transaminases to twice normal concentration, pulmonary edema, or new onset cerebral or visual symptoms can also make the diagnosis. The management of patients with preeclampsia involves weighing the risks of maturity of the fetus with the risks of maternal morbidity of worsening disease progression. Preeclampsia is managed by close surveillance until 37 weeks estimated gestational age. This involves monitoring the mother carefully with frequent blood pressure monitoring, serum, and urine evaluation to watch for disease progression. Antihypertensives, such as hydralazine, labetalol, or nifedipine, should only be started if the blood pressure exceeds 160 systolic or 110 diastolic. Ultrasound for fetal growth should be offered, and if evidence of restriction is found, fetal placental assessment, including umbilical artery Doppler velocimetry, is recommended. The fetus should be monitored with twice-weekly non-stress tests as well. Betamethasone should be administered for fetal lung maturity prior to 34 weeks estimated gestational age, and delivery should be initiated at 37 weeks. Once the diagnosis of preeclampsia with severe features is made, delivery should be initiated after 34 weeks. If there is concern for rapid disease progression, then delivery will need to be initiated even prior to 34 weeks. Magnesium sulfate is administered for seizure prophylaxis. The mode of delivery should be decided by fetal presentation, cervical status, fetal gestational age, and maternal fetal condition. Eclamptic seizures are scary occurrences, and it is critically important to stabilize the mom first, for this will stabilize the fetus. Women with eclamptic seizures should be treated with parenteral magnesium. Mode of delivery is again decided by maternal fetal condition, and vaginal delivery can often be attempted with labor induction, even in the case of eclamptic seizures. Preeclampsia is a progressive disease. The hypertension may worsen, or signs of end organ dysfunction may manifest over time, including eclampsia, HELP syndrome, placental abruption, stroke, liver or kidney injury, and ARDS. Eclamptic seizures may occur before, during, or after labor and result in high perinatal and maternal morbidity and mortality. HELP stands for hemolysis, elevated liver enzymes, and low platelets. Is usually diagnosed in the 3rd trimester of a woman with preeclampsia or gestational hypertension with symptoms of epigastric pain, malaise, nausea, and/or headaches, and can progress to DIC. All of these issues are solved by delivery of the baby and placenta. Fetal complications include fetal growth restriction and the issues associated with increased risk of preterm delivery and placental abruption.